I spent time in high school with a family doc in Wilmington, and just sort of enjoyed what he was doing with his day, seeing lots of different patients and seeing lots of different problems and going from one thing to the next, and it was very interesting. So it got me interested in wanting to go to medical school and be a family doc. The variety that we see all kinds of things, in a day, a back strain, a sinus infection, acid reflux, somebody who's had a heart bypass operation last week, a guy that had a transplant this morning, heart transplant patient. So it's all kinds of things in a day, and it makes it interesting. I think the big strength of Wilmington Health is you have all these talented people and resources, and you can leverage these resources for your patient. If you're not sure about something, you can ask. You can message the cardiologist and say, what about this, or do you need to do this? And it makes the care more efficient, it's less expensive, but yet it's high quality. And then getting things like colonoscopy scheduled, it just makes it easy there's so many more resources when you're in a larger organization. But we have the flavor of sort of being a neighborhood clinic, but at the same time we have this big resources that we can leverage. And sometimes we can provide services over here, sometimes people have to go into Wilmington, but I think it's a nice option, and as we can offer more services over here, then we try to do that. I'm boarded in family medicine, and I'm also board certified in adolescent medicine. So I'm very comfortable talking about adolescent problems, diseases, growth, development, kind of challenges, things like that. So that's kind of a small niche that I have here that's kind of unusual. Try to get some exercise, like to kayak, which is fun, do out a little hiking, travel. I was just in Germany recently, just got back from there where my wife's family lives. So we do a little traveling. So